Hi everybody, my name is Ashley Tremel and I have decided to do my lesson on the importance of hand hygiene. I thought this would be a good topic to talk about with the pandemic going on and the amount of times the CDC and even the Pennsylvania Department of Health has mentioned the importance of washing your hands. So there are three main objectives of this lesson that I would like to get across. One of them is students will be able to understand what hand hygiene is. The second is students will be able to understand hand hygiene in community and healthcare settings because they are different and there are different recommendations for both. And students will be able to recall the CDC recommendation on hand washing. We will start by asking the question, what is hand hygiene? Hand hygiene is a term that I will use a lot throughout the lesson, and it is a general term referring to any action of hand cleansing. There are a bunch of different hand hygiene practices, but we will focus on three of them. Hand cleansing, which is physically or mechanically removing dirt, organic material, and/or microorganisms from the hands. Hand washing, which is washing hands with plain or antimicrobial soap and water. And hand rubbing is applying an antiseptic hand rub to reduce or inhibit the growth of microorganisms with no need for water, rinsing, or drying, and that is with your hand sanitizers. And according to the CDC, hand washing is one of the best ways to protect yourself and your family from getting sick. So you're probably asking, why are we talking about hand hygiene? We are college-age students and learn all of this in preschool. Well, when I was researching this topic, I had come across many different articles and studies based around the lack of hand washing compliance. One that stood out to me was the one done in a girls' restroom at a college campus. In this study, someone had observed 100 women and their hygiene habits after using the restroom. In this study, 63% washed their hands with just water, 38 used soap, 32 washed for more than 5 seconds, 7 washed for more than 9 seconds, and only 2% of these women washed the recommended time by the CDC. And what stood out to me even more was later down in that study, they had said that it was likely that males had a lower rate of hand washing than females. There are a lot of benefits to practicing proper hand hygiene. By cleaning under your fingernails, scrubbing your fingertips, and using soap and drying hands on a clean towel, it significantly reduces bacteria contamination that are on your hands. Hand washing also reduces the risk of diarrheal disease, which happens to be one of the leading causes of childhood mortality. The CDC says that washing hands can keep you healthy and prevent the spread of respiratory and diarrheal infections from one person to the next. And this is really important when we're talking about the current COVID pandemic or flu season every year, or really any type of illness that is passed through the germs that are on your hands. So when we're talking about hand hygiene in a community setting, we're talking about your every day-to-day contact with the people in your life. By practicing hand hygiene, you keep yourself and your family members healthy, and you do so by frequently washing your hands. There are some key times in when you should wash your hands, and this is before, during, and after prepping food, before eating food, after using the restroom, blowing your nose, coughing, or sneezing, after touching an animal, animal food, animal waste, or handling pet foods or pet treats, and after touching garbage. You can use an alcohol-based hand sanitizer if there's no access to soap and water. However, it needs to have at least 60% alcohol. You can tell the amount of alcohol a hand sanitizer has in it by reading the label. I also wanted to mention hand hygiene in healthcare settings. This is because many of us are going into different healthcare fields upon graduation, and I thought that this was something that you could take with you later down the road. So an alcohol-based hand sanitizer is the preferred method for cleaning your hands when they are not visibly dirty. This allows less skin irritation and dryness than soap and water, and is more effective at killing potentially deadly germs than soap. You should, however, wash your hands with soap and water if they are visibly dirty. You should also always clean your hands after removing gloves. Gloves prevent cross-contamination, but they do not prevent your hands from becoming infected with germs. Healthcare providers should also clean their hands around 100 times per 12-hour shift. According to the CDC website, there is a recommendation on hand washing. They emphasize 5 terms: wet, lather, scrub, rinse, and dry. So first you should wet your hands with clean running water, turn off the tap, and apply soap. The clean running water does not have to be hot, however, it should be warm. Next, you're going to lather your hands by rubbing them together with soap, covering the backs, between your fingers, and under your nails. Next, you're going to scrub your hands for at least 20 seconds. If you need a timer, they suggest singing the song Happy Birthday twice. You should also rinse your hands under clean running water. And finally, dry your hands using a clean towel. If there are no clean towels available, air drying is also okay. So that is everything that I had planned for this lesson. So next we're going to take a little assessment about 3 questions just to see if you had learned the information that was intended throughout this presentation. So the first question is true or false? Hand washing reduces the risk of many diarrheal and respiratory diseases. I'll give you a couple seconds to answer that. And it is true. Hand washing does reduce the risk of many diarrheal and respiratory diseases. Okay, so the second question is, what order does the CDC recommend you wash your hands? Is it lather, rinse, scrub, wet, dry? Wet, scrub, rinse, lather, dry? Scrub, lather, wet, rinse, dry? Or wet, lather, scrub, rinse, dry? I'll give you guys a couple moments for that. And finally, how many times should a healthcare provider wash their hands in a 12-hour shift? Is it 50, 100, 1,000, or 75? And the answer is 100. You should wash your hands 100 times during a 12-hour shift. Thank you guys so much for listening and watching this lesson on the importance of hand hygiene. I'm hoping that you learned a little bit of something, or it had reinforced something that you had already known. If you have any questions, you can leave them below and I can try and answer them. But other than that, that's everything that I have for you. So stay safe, stay healthy, and keep washing your hands. Thank you.